And for the past month, I had the honor of interning at the Dialysis Center of Lincoln. Along the way, I learned a tremendous amount about the kidneys and what they do. Everyone always discusses about how important the heart and the lungs are, but you never really hear anyone discuss about how important the kidneys are. So what is it the kidneys do? The kidneys remove waste and toxins and excess fluid and concentrate it in the form of urine. They're known as master chemists in the body because they regulate potassium, calcium, and phosphorus levels. They also regulate blood pressure and produce red blood cells. Many problems arise when the kidneys begin to fail. Fluid levels increase, which causes swelling, and many patients experience difficulty urinating. Many patients are also lethargic because of the toxins building up in their body. Many patients also experience high blood pressure and anemia. There are many different routes of treatment for those faced with chronic kidney disease. There's the option of a transplant, as well as dialysis, both hemo and peritoneal dialysis, as well as medications, or the option of no treatment at all. Knowledge is power in deciding the best option for oneself. So what is dialysis? Dialysis is the clinical purification of the blood, oftentimes using a machine to substitute the functioning of the kidneys. There are two main types: hemodialysis, which filters out the blood and filters out the toxin. Dialysis Center of Lincoln, or doing it at home. There's also peritoneal dialysis, which uses the peritoneal wall and a special fluid to filter out the toxins. Many opt for this as there are fewer lifestyle restrictions for this option. And for this past few weeks, I've been working on a research project that are newly admitted or patients who have been at the dialysis center for 18 months or less. My research project was similar to the project formerly known as the functional status of elderly adults before and after the initiation of dialysis. This examined if dialysis maintains or depletes the functional status of the kidneys, and it also looked at how much a patient can do on their own. By looking at how frail or dependent a patient is, physicians can determine if a patient would be burdened by the amount of commitment needed for dialysis. So from knowing this information, I formulated my research question. Are patients who are more independent able to receive greater outcomes from dialysis treatment than those who are more frail and dependent? I believe that by understanding the level of dependency in new admissions patients at the dialysis center, I will be able to predict which patients will have the most positive outcomes from dialysis treatment. To collect my data, I used a questionnaire to ask questions such as their living arrangements, their age, their marital status, their employment status, and their ability to perform simple everyday tasks on their own. I conducted interviews using this questionnaire, and I entered the results into a spreadsheet. And what I found after interviewing 13 new admissions patients at the Dialysis Center of Lincoln is that the average age of the patients was 65.3 years old, and the population was 69% male. I also found that over 2/3 of the patients were Caucasian, and the rest were either African American, Native American, or Hispanic. And this graph shows where and whom the patients were living with at the time I interviewed them. The blue shows that they were living alone, and the red shows that they were living with someone. What I found is that most of the patients lived at home with someone, and only one lived in a nursing home. And then when I asked about their marital status, I found that 7 out of the 13 were divorced, 2 were married, 2 were widowed, and 2 were single. And then I asked about their employment status as well, and I found that none of them were working, either because they were retired or on disability, or unable to work, or forced to quit their jobs due to the demands of dialysis. I then asked about their ability to drive or transport themselves to dialysis, and 4 out of 13 were able to drive themselves. The rest depended on other means of transportation, such as busing services, cabs, or their family. Many patients with chronic kidney disease have coexisting conditions, the two top being high blood pressure and diabetes, which was also common in my population. Heart conditions are also related. And to calculate the patient's functional status, I asked them how well they were able to perform daily tasks such as eating, walking, and showering, and I rated them on a scale from 0 being independent to 4 being dependent. I added their scores from the 7 questions I asked, and I got their functional score. And what I found is that the older the patient was, the higher their scores tended to be. There was one outlier, however, who scored a 15 out of 28, and they were still able to function mostly on their own. So this research shows that the more independent a patient is, the more compatible they are for dialysis. And it is significant because the healthcare team can effectively discuss which treatment plan is best for each individual patient. One interesting point I found while doing my research is when I asked the patients how they prepared for dialysis, nearly all of them said that there was no way to prepare. So I would like to acknowledge Dr. Mary Lou Buss and Dr. Leslie Spry for everything they did for me in helping me see medicine from a different perspective. I couldn't have asked for better mentors in a way and a better experience for everything they've done. I would also like to thank Emily Manti, Carol Andriga, Dr. Carrie Ward, and Paul Edwards for their willingness to help and provide me with this experience. And I'd like to thank everyone else who was involved with this experience as well. Does anyone have any questions?
Are you still going to be a perinatologist?
Possibly. Really interested in that still, so we'll see. Anything else? All right, thank you.